Yeah, the local hospitals across Bath, Swindon and Wiltshire are really busy, and COVID-19 is definitely still having an impact for us. So, for example, at the end of November, there were 85 people across the three hospitals needing care and treatment in a hospital, compared to only 6 people who would have needed that treatment at the end of June. So our colleagues are definitely still busy responding to people who need that care. And of course, we're all mindful that there's been a new variant detected in South Africa that we know has entered the UK. So we are busy making sure that we are ready to respond to the impact that that may have for our local communities.
Okay, so I think with all viruses, and we've seen this with COVID-19, as new variants do arise, some of them we class as variants under investigation, where we do more information, we do more data analysis on them. The Omicron is a variant of concern, and so we just really need to be careful about how we manage that now that we know that we've got cases in the UK. Now, there are those really simple preventative measures that we can all use, which will help protect us not just against COVID or this new variant, but against a lot of winter illnesses. So that's really good hand hygiene, making sure you're wearing your face covering when you're in enclosed and busy spaces, and now in terms of shops and public transport, but also making sure you're going for your booster, your vaccination, and also looking out for any symptoms. So you self-isolate as soon as you've got any symptoms of COVID. And particularly with this new variant, if you're contacted and informed that you've been a close contact of a case of Omicron, then even if you're double vaccinated, you will still have to self-isolate for 10 days. So it's a really layered preventative approach which will help us to keep cases of the new variant down and give us that time to make sure we've got vaccines going into people's arms and we're learning more and more about the variant.
We understand that for some people, they are finding it quite difficult to make appointments to see the people that they need to see, whether that be their GPs, sometimes pharmacists. What we would say is that from an emergency point of view, the three hospitals are still very much open for business, but we would ask people to think about whether the problem you've got or the symptoms you've got really warrant being in a hospital, because we want to be able to direct our resources and our care to those people that need it most. So there are other things alongside GPs, such as the NHS 111 service, local pharmacists, who are all able to help depending on what your problem is. And we would just ask people to choose wisely, really, in relation to what service you think is most likely to be able to deal with your problems. If you genuinely think you've got an emergency that needs attention really quickly, then of course we would encourage you to keep coming into the hospital and make sure that you get the help that you need. The other thing that I would just offer a bit of general advice for is to be as well prepared as you can during the winter months and kind of keep a really well stocked medicine cabinet at home. So it's not unusual in any given winter for kind of common colds and bugs and infections to spread in our communities. Therefore, having some of the things that you can buy over the counter at the chemist that might be helpful in those situations when you need them and having them to hand is something that I would really encourage people to do. So alongside any Christmas shopping and other things you might be doing, it might just be useful to remember to have some things in that cabinet should you need to call on them in the middle of the night or when things are not always as available as they might be during the daytime.